This is a very important topic as well, and that's again for paucity of randomized evidence. The data that we have from dawn stop at 24 hours. So the late window, the traditional late window, so to speak, stops at 24 hours. So what about patients who may present with large vessel occlusion beyond 24 hours? And that was the topic of the select late publication that went out in JAMA Neurology at the end of December in a non-randomized fashion, retrospective cohort, international one, from sites in the United States and our collaborators in Europe and Australia and New Zealand. We had over 300 patients that were treated with thrombectomy and or medical management, and we showed that thrombectomy may improve patient outcomes, even if they are presenting beyond 24 hours. And I say may because we have to keep the evidence within the lines of the design and the level of it, which is, this is probably, well, I'm not going to say probably, this is the best available evidence on patients in the very late window, so to speak, more than 24 hours, but it remains non-randomized evidence. But, colleagues can apply their judgment when treating the patients, but at least at this point, they have a good level of evidence that shows that thrombectomy may be effective with a good safety profile in this population. We believe that when you have a large vessel occlusion and lack of perfusion, that reperfusion remains and will always remain the mainstay of the treatment and give the patient their best chance of getting better. There are some patients that we may exclude because we believe the treatment's harmful, but to us, opening the blood vessel, beating, not opening it, in every single day of practice with certain exclusions. So extending the treatment to include more patients, offering hope for more patients, and offering evidence for those would reflect first on the patients and their families, then reflect on the healthcare and the societal cost of having less disability, and on our practice all, which is very satisfying to us to see patients improving. And I hope that this evidence gets applied in the daily practice, as you mentioned.